Welcome to the Clinical Education Initiative podcast, Conversations with CEI, where we feature conversations with clinical experts, their experience and insights on current health issues in the areas of HIV, primary care and prevention, sexual health, hepatitis C, and drug user health.
Hello, I'm Tony Urbina, the Medical Director for CEI's HIV Primary Care and Prevention Center of Excellence. I am a provider and professor of medicine at the Icahn School of Medicine at Mount Sinai Hospital, who has worked in HIV and LGBTQ health for over 20 years. In May 2024, the Centers for Disease Control and Prevention released its annual HIV surveillance reports. The new data show a continuation of year-over-year reductions through 2022 in the estimated number of new HIV infections in the United States, but disconcerting trends amongst Latino people, the country's second largest racial or ethnic group after white non-Latino people, reflect persistent failures in HIV prevention and treatment systems that this overall progress has overshadowed. Today's episode aims to get to the bottom of this glaring inequity with one of our nation's leading experts. Dr. Vincent Guillermo Ramos is a noted champion of making the invisible visible, from a sustainable fix for our broken health system to what he calls the invisible Latino HIV crisis. A transformative leader in the development and evaluation of scalable clinical and social care models that eliminate health inequities and address harmful social determinants of health, and an influencer within the area of sexual and reproductive health, Dr. Guillermo Ramos is Executive Director of the Institute for Policy Solutions and Director of the Center for Latino Adolescent and Family Health at Johns Hopkins University School of Nursing, where he is the Leona B. Carpenter Chair in Health Equity and Social Determinants of Health. First and foremost, he is a nurse practitioner who's committed to optimal health for all patients. Welcome, Vincent. And thank you for joining me today. I was really struck by your piece in the New England Journal of Medicine, the U.S. Latino HIV crisis, ending an era of invisibility. And I thought the piece was really amazing, and you really highlight this concerning trend in the HIV infection rates amongst Latino communities. Do you want to talk a little bit about what the latest CDC figures indicate?
Sure. So first, Tony, let me say thank you for just a great opportunity to actually talk about this. It's been for quite some time. One of our highest priorities is making what we call the invisible crisis visible. And part of that is really reviewing the most recent data that the CDC put out just in around May of 2022, was last year, but it's 2022 data. And so what that said was that we as a nation had made a lot of progress. And that's something, Tony, that everyone listening to this podcast and even beyond the listeners should be very proud of. We have achieved roughly in the 12-year period from 2010 to 2022, a 19% reduction in new infections. And so again, I just want to say that's really important work. Yeah. We all should be proud of that. And it's something that we as a nation should be celebrating. The part that is troublesome to me, and the part that I think I would like more people to pay attention to, is that in that same period, what we see is that progress has been uneven. And in fact, for the Latino community, we've seen a 12% increase. And so that same period of 2010 to 2022, infections not going down, but in fact going up.
Could you talk a little bit more? Because I think in your paper, you said that in certain populations, so in those aged 25 to 34 MSM Latino, that you saw a 95% increase. In transgender Latino women, that was a 94% increase from 2014 to 2022. Do you have a little bit more kind of insights into why or how, or what are your thoughts about this?
Sure. So thanks for pointing that out, Tony. So I think, so within the Latino community, I mentioned that overall we had a 12% increase. But when you start to take a closer look and try to understand, are there specific groups within Latinos that are in fact experiencing more of the new infections, you see a pretty clear pattern. So first and foremost, that Latino men that have sex with men have a 24% increase. But if you push even further, Tony, and you mentioned this, Latino young men ages 25 to 34, a 95% increase in that
Wow.
period in terms of new infections. This is something that we really should be sounding a national alarm. And in fact, it's actually gotten very little attention. You mentioned the transgender Latina community, and I think this is something that is particularly important given where we are right now in our country and some of the tensions around transgender community as a whole. But when we zoom in on Latina transgender women, we see an increase in HIV diagnoses by 94%. And that's between 2014 and 2022. What is critical is that I'm not able, Tony, to provide incidence data because we don't collect data on incidence for transgender females and transgender people, period. And so what we are reporting in our paper are the diagnoses. Some folks would say that diagnoses could be indicative of actually a positive outcome because it would suggest that people who are living with HIV have been identified and therefore have the opportunity to be linked to care and to benefit from really effective treatments. I want to push on that a little bit. While I agree with that, I also think that these increases in diagnoses are so high that I think that what's probably more likely is that there are increases also in incidents that are just not being picked up because we're not collecting incidence data on that particular community.
Which is unfortunate. And we're going to talk a little bit more about the current climate as well. You also, Vincent, state that this crisis may stem from multiple factors. So inequitable access to HIV prevention and testing and treatment, harmful social determinants that disproportionately affect Latino communities. And again, this invisibility, I think, is a great term that you reference. How do you think this crisis can be reversed?
So I think the good news is, Tony, that we've made so much progress as a nation that we know how to actually improve things when it comes to HIV. And I want people who are listening to this to be hopeful and to see and to be optimistic that we can do it. I think that there are some specific steps. And the first step we're actually working on together, you and I, and many others, which is what you said, making what is invisible less or more visible and less invisible. And so we've got to get broad communities to care about this and to realize that despite all of the information about the US ending the HIV epidemic, that there are still groups that are not only being left behind, but where things are worsening. And so some of us might be imagining, hey, what does this have to do with me? I'm not Latino. I'm not a Latino gay man. I'm not a Latino person who identifies as transgender, female. And so I want each and every person who's listening to this to imagine being in a situation where you were faced with a challenge around being able to access prevention and treatment. And imagine that you yourself are a Latino person. Think about the barriers that you just mentioned. They can range from not having health insurance, not being able to speak the language that is being spoken in the place where you receive healthcare, not feeling welcomed and feeling like there's stigma or discrimination against you because of who you are, or not even, Tony, having the ability in many parts of our country to even get there because you lack transportation. And just think about what I think will resonate with many people, the golden rule, and really wanting to be treated you the way that is in your best interest as an individual. And imagine that also being something that you would want for other people. I think when people think about it that way, they might feel differently, and it might help us to better engage the Latino community in meaningful ways to help us to redesign the things that we know actually work and that are effective in ways that will better respond to Latinos. And that means getting HIV prevention and treatment directly to Latinos. And it also means addressing the everyday social conditions that make life difficult and don't allow people to benefit from prevention and treatment for our purposes, the Latino community, and also to ensure that life-saving research in our country that increasingly is experiencing direct challenges, that we're able to use evidence to generate our prevention and treatment responses and our public health response and how we can better serve Latinos and every other person in our nation.
Vincent, those are amazing points that you bring up and really important. And I think I often get asked, just with our current moment in history right now. How can we galvanize? I mean, what are our opportunities? And I mean, you spoke about some of the concerns, but could you elaborate a little bit more about what we can do now?
Sure. So before I do that, Tony, I'm going to maybe just say, hey, there is a big concern. And the big concern, it isn't new. We've actually been facing this for quite some time. We all have been calling attention to the Latino invisible crisis for more than a decade. But the fact that we've drawn attention to this hasn't resulted in action. And I think the opportunity and the thing that I'm most hopeful for and optimistic, and that I want folks who are listening to think about in terms of a call to action, is that we are at a time when common ground it can seem like it's elusive. It can seem like ending the crisis in the United States, including for Latinos, is going to be hard, that it's something that we won't achieve largely because of our differences. And oftentimes that means our political tensions. But the truth is that every single president, everyone has played a role, irrespective of party, for the last 4 to 5 presidents. And they all could have done more. They've all contributed, but they all could have done more. And so now is the time with our current leadership that we can get the job done. And we really need to think about some important points, like when we cut programs and we reduce budgets, then we run the risk of curbing our progress. When we actually fail to really embrace the opportunities that have been put in front of us, we've got great prevention and treatment, which I've referenced a couple of times today, then that's something that's going to hurt not only Latinos, but everyone in the nation. And so my big opportunity is that we decide as a country that we are in fact going to end HIV, that we all get behind this, and irrespective of our political views, that we decide that now is the time for a common ground solution. That this is a huge win, not only for Latinos, but for all Americans to celebrate.
Very nicely stated. I like that common ground approach, and we're all in it together. And really, to end the epidemic, it's really going to benefit us. You spoke a little bit in your paper about the importance of community engagement in designing effective responses. And I think you cited the Mpox vaccination campaign, and I agree with you. Could you maybe elaborate on specific lessons from that campaign and maybe how we can implement them to address the Latino invisible HIV crisis?
Sure. So I think taking a step back, when think about, because we actually wrote a separate paper, Tony, that is in Nature, specifically about Mpox. Mpox was an amazing opportunity for us as a nation to understand about issues of health equity and achieving health equity. When we saw that there was the emergence of Mpox in our country and that it was affecting particular groups, again, the narrative was that certain groups were those that were most at risk for acquiring active infection. But when we look at what the response was, a lot of the times the actual vaccine that would have been protective in terms of reducing the likelihood of active infection were not reaching the very communities that were most at risk.
Yeah.
So we had a disconnect. And I think what sometimes has been our national response is that either we fail to recognize that there is this difference, this negative difference that is affecting certain groups, or we have not fully owned that oftentimes that sort of difference is what some people would call, and I'm one of those people, an inequity. It's something about the unfair way that we structure our healthcare programs, the delivery of those programs, as well as policies, that then results in these differences that in fact are not about the people per se, but about the way things are structured. Well, why Mpox was really, in my mind, quite exceptional is that we started to see the emergence of differences, and we saw some things that some would argue were predictable. And so we have a vaccine. It was going to people who had lower risk, who rightfully needed the vaccine as well, but it wasn't going first to those communities that were most at risk of actually having active Mpox infection. One of the things that I love at the CDC at the time, it was Dr. Dimitri Daskalakis who was responding to the Mpox epidemic nationally and had been, to my knowledge, deployed to the White House to work on this and how to mobilize communities to respond. He organized an approach, he and his colleagues, that allowed community-based organizations, key affected populations, to be engaged. And he worked on how to move, Tony, the programs, the actual vaccine, the delivery sites to be in better alignment with where the most risk was. And that meant some of what I said in the introduction, recognizing that it was disproportionately impacting certain groups, particularly of color, particularly African American and Latino, and people living with HIV who identified as MSM. It meant really realizing that the way that we were structuring the actual delivery of the vaccine wasn't necessarily in alignment with where the people with the greatest risk were. And it also meant looking at the social conditions and the day-to-day circumstances and recognizing that things like stigma, or depending upon some of the things we mentioned earlier as part of our conversation, did they have a way to get there? Could they actually access the vaccine and understand based on language preference, et cetera, that those kinds of social issues also impact negatively whether or not somebody's going to be able to actually benefit from whatever the medical or health innovation is. Well, they did a great job turning that around, and they addressed those three things. And because of that, we start to see a correction as a country in the rates of active infection. And we saw that more people in those groups that were most at risk were actually getting the vaccine. To me, that's a huge lesson that we need to replicate. And I reference it in the Invisible Crisis paper because I think we can do the same thing for Latinos who are at risk or living with HIV.
That's great. Yeah, I agree with you there because I think I just recently attended CROI and there's this great technology. So once yearly now injection for PrEP, but those technological advances are only going to be as good as the systems that are in place, as like you mentioned, Vincent, to bring them to those populations most at risk.
Absolutely.
So it's not just having the technology. One other question. So I think your paper is also a call to action, and I think you've listed some of what you consider that to be. But one of the priority areas that you mentioned too is increasing Latino leadership in public health and in health policy as a key action for improving, I'm going to use the word again, visibility. So could you talk a little bit about this and what you feel that could do?
Great question. I love that question. One of the things, Tony, that is another tension point right now in our nation is that we have historically had public health and a healthcare workforce that has not been representative of the communities that are being served. And there's been a lot of movement in our nation around what often is referred to as DEI initiatives. And that those three letters, they represent a lot of tension in our country. And so I want to make sure that I'm very thoughtful and that I try to appeal to people that might not agree with me. So please listen to my argument. And if you disagree, that's okay. But I hope that you will consider the evidence and reflect on it. So in the health space, we have a lot of evidence around what we call concordance. And what concordance is that when you have, Tony, a patient that is from a particular experience, Latino or African American or whatever it may be, that when the healthcare provider, the public health professional, but typically it refers to the healthcare provider, there's the most evidence is really with physicians and African American patients, but there's also evidence with Latino and Asian patients. When you have alignment of the provider and the patient having a shared experience, identity. Interestingly, what we see is that there's better screening, there's better preventative interventions, there are better treatments that are offered, and the outcomes overall are better, including some of the things like patient satisfaction. I am not suggesting that every single person that is Latino has to be treated by someone who is Latino.
Right.
But I am saying that having a workforce and having an interprofessional healthcare team where Latinos are represented, particularly when it comes to the needs of serving the Latino community in our nation, is critical. And the more that we experience barriers, and we've seen some of this with, for example, the recent Supreme Court decision on the fact that we can no longer consider race as one of the criteria in admissions processes. Well, if you look, Tony, at some of the sort of leading institutions around the US, in their incoming classes, there has been less diverse and inclusive students that are joining those institutions, which worries me because it means then that our health and public health workforce in the future will be more homogeneous. And it was already not doing so well in terms of ensuring that we had Latino and other underrepresented groups. So for me, if we want to solve issues that are specific to Latino communities, we need the leadership of Latinos, and we also need to ensure that on teams that are not fully constituted of Latinos but are making decisions, that there are Latinos that are represented.
Very well said, Vincent. Thank you really for highlighting this really critical health disparity. And I mean, your words today not only brings visibility to this Latino HIV crisis, but I mean, hopefully just this roadmap for like meaningful change. And thank you for being authentic and for talking to us about this. We're really grateful for your insights. So just to wrap up here, how can people learn more about your work?
So thank you for that, because I think what we're hoping is that we're going to continue, Tony, on this campaign to make the invisible crisis less invisible. And so at CLAF, the Center for Latino Adolescent Family Health, the center that I direct that is focused on Latino health issues, clafh.org, we have a particular section that is specifically dedicated to the Latino invisible HIV crisis. We are going to continue to track where things are going. We're planning for the fall for National HIV/AIDS Latino Awareness Day, an update to the Latino crisis, and we will continue to post resources and let people know that we're in this together and that we need to end this for everyone, including Latinos.
Fantastic. So I want to thank you for listening to our conversation today. And to learn more, please check out our podcast notes or go to CEItraining.org.
Thank you for tuning in. Join us next time for a new episode of Conversations with CEI. Visit us at CEItraining.org and follow us on CEI social media platforms.